Anxiety is huge when it comes to mental toughness within female athletes. Causes of general anxiety include the ability to perform well at their sport decreases because of increased anxiety. Effects include sweatiness, increased heart rate, feeling of nausea, being overwhelmed, and a sense of impending doom. Depression is also very apparent in female athletes. It is one of the most common psychological problems of athletes. Female athletes are 3 times more likely to have higher rates of depression than men. The highest causes of depression include overtraining, concussions, injury, and upcoming retirement. Treatments include supportive psychotherapy. This involves being there for other female athletes. This is especially important for someone that is normally there for others. Another form of treatment is cognitive behavioral therapy. This helps the athlete see life from a more positive position, one that doesn't blame them for their problems. Psychological techniques that help combat depression include mental skills training, or otherwise known as MST. Some of the techniques include goal setting, positive self-talk, imagery, use of focus cues, relaxation, and activation techniques. There are many athlete benefits to this, which include enhanced performance, confidence levels, concentration capabilities, attentional focus, and a decrease in debilitating anxiety. It's best to start these practices young. If athletes start these practices at a young age, they are more likely to grow and build stronger over time. There are many famous female athletes who struggle with depression, including Amani Boyette, a professional basketball player, Amanda Beard, Olympic gold medal winning swimmer, Alison Schmidt, Olympic swimmer, Serena Williams, a global tennis champion, and Ronda Rousey, a WWE fighter.
So this is part 2 to mental toughness and depression in female athletes. In my portion, I focused on a study that is about the difference between male and female athletes when it comes to mental health. Why sports can lead to mental health issues. With relentless motivation and hard work, many women have been able to rise to the top in their sport. However, while there is psychological resilience given to many high-level athletes, this mental toughness does not imply complete immunity from mental illnesses. Practicing a sport at the highest level creates a totally different set of circumstances, creating a high-pressure career with lots of stressors. This can result in the onset of many health issues. Some of the psychological issues encountered at the elite level are depression, anxiety, eating disorders in women involved in aesthetic sports, or abuse of illegal performance-enhancing substances. Also, women are diagnosed with depression and anxiety disorders roughly twice as often as men. So this study included 2,067 athletes who were registered on the French high-level or junior-level athlete list and participated in the study. The data that was obtained was on common psychological disorders, with detail on whether these disorders occurred in the past, so over 6 months ago, were current, so within the last 6 months, or either, which would be a lifetime occurrence. With a total of 16,013 high-level and junior-level athletes registered on the national lists, the sample represents 13% of the population. So these are the results. Women were 1.3 times more likely to be diagnosed with at least one mental illness than men. Compared to men, nearly twice as many women were found to have experienced minor and/or major episodes of depression over the lifetime. Age was also associated with ongoing major depression, affecting 2.2% of the athletes over 21 years old, 0.8% in 18 to 21 years old, and 0.3% in athletes under 18. Women were also 56% more likely to have suffered from anxiety disorder over their lifetime than men. Women were significantly more likely than men to have had anorexia or bulimia. However, the occurrence of all 3 of these disorders over the lifetime was identified significantly more often in women than men. So here are some more results. The greatest prevalence of these disorders were found in athletes practicing aesthetic sports, which are gymnastics, synchronized swimming, and figure skating. This raises an interesting point regarding the possible connection between mental health and being an elite athlete in a sport in which success is heavily dependent upon judgment by others. This includes jury members, coaches, or even teammates. By others having the power to judge you on a performance you work so hard on, the pressure to be perfect is tremendous. Judges can also be inconsistent or affected by a number of factors, including the nationality of the athlete, or for political reasons as well. The sense of powerlessness in these sports is well documented as one of the triggering factors for anxiety disorders and depression. This is because the power of winning is in someone else's hands, not their own.
Okay. So, as we mentioned before, depression is a very common challenge between not only athletes but between female athletes across the country. Depression can not only affect others but those who experience depression post injury too, which I think is very important, as there are many injuries within athletes, going from the high school to the collegiate and even the professional level. Female athletes are constantly working every day, possibly year round, to better themselves at their own sport, which they love. But what happens when they are injured and they are faced with this challenge of not knowing how long their recovery time is? This is also a question for not female athletes, but for everyone else who suffers an injury and all they want to do is to feel good and healthy and get back into their sport. And this is where post-injury depression comes into the picture between not only females but male athletes too. Females are almost, as mentioned before in our presentation, they are 3 times as likely as men to experience major depression each year. Going back to our discussion board from this week, we talked about the female paradoxes that are in our society, which was that we pictured females to be a very fit and healthy athletes with a beautiful image that is accepted into, not into this world but by the world. Not only this, but we also picture them to be the gender to be allowed to cry or mourn, and possibly the gender to be known to be more depressed. But when it comes to male athletes, or just males in general, we do not hear much about males who are depressed. But when we do, we think that they'll get over it and they'll just need to man up, which is, from what we know, a majority of male athletes could be hiding these mental problems to keep that paradox of masculinity, which is not healthy for the individual. And we just hope that they can talk to someone when they are ready. For the levels of distress, I have found that athletes with injuries experience a higher level of distress than those with little to no injuries who have the lower level of distress. As I hit up the topic of the common emotion, that being depression, it will continue to be one of the most common emotional reactions to an injury. And with this emotion rising to the female professional levels of sports, they each experience a different state of mind, introducing different disorders. Different disorders or common symptoms. Some of those being the lack of motivation, little to no sleep, feeling sad or down, low energy to get through the day, can't concentrate, or even a lack in participating in their sport, which, if you've ever been in a sport, you could relate to some of these. And then, now depression can not only affect female athletes as a whole, but it definitely affects them differently, even if it's an athlete who's a part of a team sport. But what about females in individual sports? Think to yourself, and have you ever been in a team sport? Do you think you've ever felt depressed or upset? Possibly. But who was there to pick you up and bring you out of your shell, so to speak? Your team, obviously, because they were there with you to experience a match or a game that you all felt upset about. Which brings us to the risk with organized sports, where the risks of anxiety, depression, and even the feelings of hopelessness are low. The symptoms for athletes are not as high as those in individual sports. Female athletes who are a part of a team sport encourage fitness while also creating better mental and social skills within themselves, working well with others as they contribute to the group. But when it comes to individual sports, they can improve on their own, but at times they will provide less of social skills, ultimately creating shame after their failure. This type of failure in an individual sport is connected to depression, but both team and individual sports teams, or athletes, they share certain aspects of depression within their sports, and it is shown within the team sports article that is in our on the last slide, that individual sport athletes are more subject to depression and anxiety, but it is also varied between athletes.